USMLE Step 2 has consisted of two separate exams, USMLE Step 2 Clinical Knowledge, or CK, and USMLE Step 2 Clinical Skills, CS. And in case you didn't know, the latter has been cancelled permanently. But USMLE Step 2 CK tests your theoretical clinical knowledge. So at this step, there's a lot on the line because acing this test can also help you get into some of the most competitive residencies out there. So in this video, I'll explain what USMLE Step 2 CK is all about, from exam format and content to specific tips to help you ace this challenging exam. Hi, I'm Natalie Stoberman and I'm an admissions associate here at BeMo. Before we get started, subscribe on whatever social media channel that you're watching this on so you don't miss any of our upcoming videos. And if you'd like us to help you match to your top choice residency program, visit BeMoResidencyApplication.com to schedule your free initial consultation. FYI, check out the timestamps in the description of this video so you can navigate to the specific sections that you're interested in. Here's what we're going to cover. What is USMLE Step 2 CK? USMLE Step 2 CK exam format. USMLE Step 2 CK content. USMLE Step 2 CK question formats. And exam taking tips. And we're giving away $50 Amazon gift cards every week to the best comments and questions. So comment below for your chance to win. We also have some stellar advice on how to successfully prepare your USMLE Step 2 CK study schedule. I'll talk about that more towards the end of the video, and you don't want to miss it. So let's get started. What is USMLE Step 2 CK? The USMLE Step 2 CK evaluates your ability to apply medical knowledge, skills, and understanding of clinical science important for the delivery of patient care. One of the underlying themes of this step includes an emphasis on health promotion and disease prevention. Thus, Step 2 CK is designed to ensure an examinee's devotion to and understanding of the principles of clinical sciences and basic patient-centered skills. Essentially, this exam tests your readiness to enter medical practice as a supervised, not quite independent professional. In addition to testing your clinical knowledge and theoretical knowledge of clinical skills, Step 2 CK will also prepare you for the OSCE elements of your licensing examinations. This means that students typically write the USMLE Step 2 CK exam in their fourth year after completing the majority of their clerkship rotations. USMLE Step 2 CK exam format. Like USMLE Step 1, the Step 2 CK is a one-day examination. The entire test is divided into 8 60-minute blocks and administered in one 9-hour session, with an authorized 45 minutes of break time and a 15-minute optional tutorial. You can possibly add more break time if you finish your sections early. And one way to gain an extra 15 minutes is to skip the optional tutorial by downloading and practicing the test interface prior to exam day. To get familiar with the USMLE Step 2 CK test format and software, practice with the exam tutorial and practice test items before your test date. Then you can also get more familiar with the types of questions that you'll face, like single and sequential multiple choice questions, scientific abstracts, and items with audio or video findings. USMLE Step 2 CK content. This portion of the USMLE Step 2 includes questions that assess system-based practice, patient safety, legal and ethical issues, and professionalism. All USMLE exams are designed based on the integrated content outline, so I highly advise that you go over this document before you even start studying. The bottom line of the USMLE Step 2 CK content is structured according to general principles and individual organ systems. Clinical knowledge questions are organized into one of the 18 major categories, depending on whether they focus on concepts and principles that are applicable across organ systems or within individual organ systems. In most instances, knowledge of normal processes is evaluated in the context of a disease process or a specific pathology. But do remember, while not all topics in the content outline will be included in every USMLE exam form, Generally, content coverage is still comparable among the various exam forms and steps. Consider this USMLE Step 2 CK content breakdown. Medicine, roughly between 50 and 60% of the exam. Obstetrics and gynecology, 10 to 20%. Pediatrics, 10 to 15%. And surgery, 25 to 30% of the content breakdown. Each USMLE Step 2 CK exam form will cover content related to these disciplines. USMLE Step 2 CK question formats. Like I mentioned earlier, you will face different types of multiple choice and abstract questions. But allow me to dig a little deeper into these question types so that you have a better idea of what to expect. Single item questions. This is the most frequently used multiple choice question format. This question type consists of a vignette and question followed by 3 to 26 responses that are organized in an alphabetical or logical order. You are only asked to select the correct response, and keep in mind that other options may be partially correct, but there's only one best answer. Sequential item sets. This question format presents you with a single patient-centered vignette with 2 or 3 consecutive questions about the patient problem. Each question is related to the vignette presented, but is testing a different point of the patient problem, so you must choose the one best answer to each question. And it's important to remember that once you answer the first question, you must click Proceed to Next Item to view the next question related to the vignette. So once the next question appears on the screen, you will not be able to change the answer to the previous question, even though the patient problem is still the same. The questions are designed to be answered in sequential order, so pay attention to what you're being asked and the answers that you select. Abstract format. The abstract format questions include a summary of an experiment or clinical investigation presented in a manner commonly encountered by physicians. For example, you could be presented with an abstract that accompanies a research report in a medical journal. Test takers must interpret the abstract to answer questions on various topics, including decisions about care of an individual patient, biostatistics and epidemiology, pharmacology and therapeutics, and the use of diagnostic studies. Exam taking tips. The amount of information that this exam covers can be overwhelming, but Step 2 CK does test more than your clinical knowledge. In addition to preparing for the content that you'll encounter in the exam, you should also work on your exam taking strategies. And as you go through practice questions, make it a habit to perform the following strategies to increase your exam endurance and stress management. Read each question carefully. You need to understand exactly what is being asked of you. Remember that your ability to pay attention to detail and use common sense are also being evaluated. If necessary, read the vignette and its questions several times to take note of any details. You will need to address the patient problem and the questions that follow precisely, so make sure that you comprehend your task. Try to generate an answer before you look over the responses that are offered to you. Coming up with solutions of your own is a great way to train yourself to face any possible scenarios that you'll face in Step 2 CK. Rather than just relying on the response list, you can train yourself to deduct the correct course of action independently. Once you decide how to answer the question, you can choose the answer that best corresponds to your solution. You will undoubtedly run into patient problems and questions that will stump you. And if you cannot come up with your own answer, go ahead and read each option carefully. If you cannot identify the best answer from the get-go, start by eliminating the clearly incorrect options. Select the option that you deem most correct out of the remaining options. And remember to always choose an answer, even if you're not sure whether you chose the right option. There is no penalty for guessing, but unanswered questions are automatically counted as wrong. How to prepare for USMLE Step 2 CK. To prepare for the USMLE Step 2 CK, focus on broad-based learning that forms a strong understanding of concepts and principles in the basic and clinical sciences. Here are some study strategies that will help you find some ease before testing. Do well on your subject exams. Med students generally must take a shelf exam after each major rotation, which tests their knowledge of the material in that rotation. These comprehensive exams share the content of USMLE Step 1 and Step 2 CK, and they'll help you identify your strengths and weaknesses before you take the actual exam. Doing consistently well on the shelf exams means that a student will be well prepared by the time the Step 2 CK rolls around. Start your review early. I can't stress this enough. As you start med school, you should keep your USMLE steps in mind. Cramming for any of the USMLE exams a few weeks before the test date is not going to result in a good score. To ensure your success in the USMLE Step 2 CK, form good study habits to retain new content and immerse yourself in your studies going back to your first year at med school. Get used to studying the content of Step 2 CK as soon as you start your medical school rotations. Set aside a few hours each week to go over content that you covered in clerkships. And reviewing your materials every week will solidify your knowledge base so that when test day rolls around, all you'll need to do is simply review your notes and study materials. Focus on your clerkships. Once you pass your USMLE Step 1, a lot of the clinical knowledge that you'll want to retain and implement will be covered in clerkship rotations in your program. Clerkship years are difficult. In addition to the strenuous amount of work and learning, students tend to have less free time to relax, eat, or even sleep. And on top of that, many students start to worry about the residency match, potential career choices, and doing well on their Step 2 CK. While it's natural to have worries when you're overwhelmed, we strongly urge you to focus on the content material that you'll be presented with in each rotation. This will be the key to your success in the USMLE Step 2 CK. Approach each clerkship rotation as if you're seriously considering this as a potential career choice. Learn, understand, and memorize all the basics needed to perform in that field of medicine. Not only will this allow you to hone your clinical skills, but you'll be able to assess your fit for each specialty honestly because you gave 100% to each rotation. Practice tests. Many students swear by the UWorld practice tests and question bank. Subscribing early to the UWorld question bank soon after concluding Step 1 and beginning your clinical rotations is a wise move. However, the UWorld practice tests themselves have been reportedly inconsistent for students in terms of predicting their scores, and we'd emphasize the quality of the question bank itself rather than the practice tests. And additionally, the AAMC offers a series of USMLE practice tests which are actually old test forms that may be more accurate in reflecting the exam and predicting your scores. Whether you choose the UWorld or AAMC practice tests, take those practice tests as many times as possible. And don't forget to make notes about the content that you struggle with. That way you can customize your study schedule to compensate for the areas where you need more help in. Those are our tips for a successful study prep for the USMLE Step 2 CK. Check out our blog to find more resources to ace the USMLE Step 2 CK. I've included the link in the description of this video for easy access. And if you'd like us to help you match to your top choice residency program, visit BeMoResidencyApplication.com to schedule your free initial consultation. Hopefully you enjoyed this video, so please subscribe, like, and leave a comment. And if you have any questions about the USMLE Step 2 CK that I didn't cover, let me know in the comment section, and I'll get back to you as soon as possible. And don't forget that we're giving away $50 Amazon gift cards every week to the best comments and questions. So comment below for your chance to win. Thanks for watching, and we'll see you next time.